Good morning, dear students. So we'll be seeing some of the questions which is related to the eye and ear development, which was given to you yesterday. If you have any questions, you are welcome to email me, or you can put it in the comment section. Thank you. The first question, the questions could be randomly placed. Okay, it's not the one like the order in which it's been given to you. The earliest presence of the development of the internal ear can be seen on the surface of Telencephalon, Diencephalon, Rhombencephalon, fourth ventricle, or the cerebellum. So here you can see this is the developing aortic placode, so which later on gets into an aortic pic and then the aortic vesicle. In the center, this is the wall of the rhombencephalon, and this is the one which would be giving rise to the internal ear. So the answer is Rhombencephalon. The next question, the middle ear or the tympanic cavity takes origin from which one of the following structures? First pharyngeal arch, first pharyngeal pouch, second pharyngeal pouch, second pharyngeal arch, or the first pharyngeal cleft. In this picture, you can see a tubotympanic recess. This is the one which later on gets transformed into middle ear as well as the auditory tube. And this is the part which is arising from the first pharyngeal pouch. Okay, the pharyngeal arch is in the outer aspect, whereas the pharyngeal pouch is from the endoderm, which is from the inside. Okay, so this is the one which would be giving rise to the middle ear, the tubotympanic recess, and the auditory tube as well. The footplate of the stapes takes origin from which one of the following structures? We know that the stapes is arising from the second pharyngeal arch, along with the styloid process, the stylohyoid ligament, and the lesser horn of the hyoid. But here specifically we are asking about the foot plate of the stapes. Is it from ectoderm, endoderm, neural crest cells, telencephalon, or diencephalon? It is arising from the neural crest cells. Okay, so the foot plate of the stapes has its origin from the neural crest cells. There is a line regarding this in the latest Langman's embryology. Okay, so the question is taken from that aspect. Okay, so the neural crest cells is the one which should give rise to the footplate of the stapes. Pinna usually develops from the auricular hair logs located along the first arch, second arch, both the first and second, third arch, both the second and third arches. So here you can see the frontonasal process. This is the first pharyngeal arch, which is comprised of maxillary mandibular process. And here you can see the auricular hillocks 1, 2, 3, 4, 5, 6, which later on transforms and forms the pinna. Okay, the different parts of the pinna which you would be discussing in the uh, gross anatomy of the ear. So the auricular hillocks, you can see it is arising from both the first pharyngeal arch as well as the second pharyngeal arch. So the answer is both the first and the second pharyngeal arches. The statoacoustic ganglion develops from vesicle, optic placode, mesoderm, first or second pharyngeal arches. Okay, so here you can see there is the developing optic placode. Okay, the optic vesicle, which later on forms the optic vesicle, and just closer to the optic vesicle, there are two ganglions, which is the statoacoustic ganglion. Okay, so the statoacoustic ganglion is the one which later on transforms into vestibular and the cochlear ganglia. This ganglia arises from here, this vesicle, which is the optic vesicle, and it also arises from the neural crest. Okay, so if the neural crest has been given, so that would be the answer. Okay, child of which one of the following mothers is least or might not suffer from the hearing loss? Or we can ask this question as which has got a proven effects that there will be hearing loss in the child. a pregnant mother with a cytomegalovirus, an unvaccinated teacher, okay, so in which one of the students is suffering from rubella, a pregnant mother with influenza, a pregnant mother taking retinoidal treatment, an uncontrolled diabetic female. Okay, so out of all this, a pregnant mother suffering from influenza, okay, so will be the least, okay, or might not suffer because there are not much cases which prove that it can lead on to the hearing loss. However, the cytomegalovirus, rubella, retinoidal intake, as well as uncontrolled diabetes have been linked with congenital hearing loss. Is an iridia. I forgot to bold this out. So the answer here for this question is an iridia. So this is because of the non-development of the anterior aspect of the choroid, as shown here. Okay, so here you can see a keyhole pupil. So the inferior aspect of the iris is not developed. So this is because of the failure of fusion of the choroid fissure. Why it's not the fusion of optic vesicle? If it is an optic vesicle, then there could be an entire defect of the eyeball. So even the sclera would be affected. Okay, so that would be more gross abnormality. But here you can see only the cornea is normal. Okay, the sclera is also quite normal, and it's only the inferior aspect of the iris which is slightly defective. So the answer is failure of fusion of choroid. The surface ectoderm gives rise to which one of the following structures? Is it sclera, choroid, lens, retina, or the dilator pupillae? So from this picture, you can see the surface ectoderm, which can give rise to the eye. It is the lens. Okay, so you can see the lens. The other parts, they are developed from the optic vesicle. Okay, so whereas the lens, it is getting invaginated from the surface ectoderm. Okay, so it gets invaginated and then it forms it develops from the surface ectoderm. So the answer is lens. Autopsy of the child is shown in the picture shown below is most likely to be associated with which one of the following abnormalities. So here you can see an abnormal baby, and you can see there is a single eye. So this is called cyclops, or it's also called as cyclopia or synophthalmia. That is, both the eyes are united. Okay, so this is because of the maldevelopment of the frontonasal process. You can see the nose. Okay, or it's here it is called as proboscis. Okay, the proboscis. So what is the most commonly it is associated with? Retrolental fibroplasia, we cannot see that in this case. Aphakia, okay, and this is also not so commonly associated. Congenital cataract, retinal detachment. Okay, so this could be there, but the one of the things is very common, so which is single telencephalon. Okay, the single telencephalon. You know that the telencephalon is the one which separates into two and forms the right and left cerebral hemisphere. So here there is a single telencephalon, so which is called as holoprosencephaly, in which there will be the absence of corpus callosum. So this is one of the most commonly associated defects in this case of cyclops, right? So this is regarding some of the questions which I have administered before. If you have any doubts, you are welcome to email me or contact me through this YouTube channel. Thank you so much.